Hello, everyone. I'm on this interview with Dr. Avi Sudhakara, and we're going to talk about the importance of tracking your alcohol or alcohol consumption. Now, Dr. Avi, if you want to say something about yourself?
Hi, how are you doing? My name is Dr. Avi Sudhakara. I have a practice in Trenton, Michigan. I'm a board certified internal medicine physician practicing here in the community I grew up in. And I have the pleasure of being interviewed by Mandi, who wanted to ask me questions about alcohol. So I'm gladly answer some questions. These were not, I don't even know the questions you're about to ask, so it'll just be straight from the hip.
Right. So, with your practice in general medicine, how do you feel about regular alcohol consumption in a day-to-day use?
So this comes up a lot in my practice, especially in the demographic where we live and everything. Alcohol is a substance that is overlooked. There's a lot of regulations on other substances, tobacco, marijuana, all these other substances. But alcohol really is one of the factors that people don't really consider taking as harmful. People will drink it as a social event. People will drink it as a celebration event. People will drink it as to deal with some emotional stress or anything. So, and on a day-to-day basis, it's hard to tell people, hey, how much are you drinking? This on the weekends versus the weekdays. And it is one of those things that you should be aware about how much you drink because it affects your body tremendously.
Mm-hmm. And have you ever seen anything within your field, within maybe hospital, clinical, any sort of patient where they had like this huge issue in alcoholism, how it might have affected them poorly in terms of their health, maybe their physical state, their mental state, anything along those lines?
Yeah, absolutely. Unfortunately, alcoholism is a disease, and as a criteria, it's an addiction, and it's hard to overcome. So the things that happen when you drink alcohol, when your body breaks down alcohol in your body, it gets broken down even in your neurotransmitters, your cellular level, as in the way your blood is made. It affects a lot of things like hormones. It affects your sleep. It affects mood. It affects even down to the blood. I said, if you are an alcoholic, I can just tell by just getting simple blood work. I can look at your CBC and know, oh, this person drinks alcohol because of your hemoglobin itself will be different. The shape of it, how much it can actually carry oxygen, all those make a huge difference. So, and talking about it affects more than your body as well. It affects you mentally as well. Research has shown that it can lead to early dementia, early Alzheimer's. Your brain, you can look at scans and see an alcoholic versus a normal person that does not drink. So it affects your body, your mind, your mood, everything. And the most common thing is people think, oh, it's just liver disease.
Mm-hmm.
But your liver is one of those organs that takes the brunt of it, but it's so powerful that by the time you get liver disease, you have so many other complications like your heart. Your heart gets enlarged. It's a muscle, so you would think an enlarged heart would be better for you, but in fact, it actually produces less blood, less oxygen, so you're under shortness of breath, you're stressed. So all these are dangers that can just be from consuming too much alcohol.
Right. And one of the biggest issues that I noticed is that it's kind of overlooked because a lot of the times when people drink it, it's usually at social events, any times where it's times for enjoyment and so on. And I always wondered, I know that you've definitely had moments where you've shared those times with your coworkers and perhaps friends and so on. But is there any way where you can drink but in a sensible fashion, in a much more lighthearted tone where you're not constantly slamming day by day, but rather on the by?
Well, overall, drinking alcohol, is there a benefit? Studies have shown that, this cardiac study would say, drink wine a day would help your heart and everything. Those are all, you have to look into the studies. There's a lot of confounding factors where things like, is it just alcohol that actually helped their heart, their coronary artery disease and all this? But there's a lot of confounding things such as socioeconomic status, all this. So those studies that show that alcohol is a benefit is there really aren't none like that. There are some studies that show it can raise your HDL, but just for foods can do that. Exercise itself can do that. So if
Right,
you're
yeah,
only
exactly.
drinking to improve, there's nothing that alcohol actually improves. But having said that, why do people drink? Well, you have to think if there's no benefit physically have any, it's mostly for either emotion, either stress, anxiety. Some people are able to, in a social setting, your anxiety gets a little less by drinking alcohol or anything. Now, is that a good way to deal with it? No, but
No.
it's a readily available way. And some people, majority of people, they can do that and not be an alcoholic per se. So
I suppose so. But you would say at the bottom line though, if it is your go-to, then it's just straight up labeled as addiction all the way through. So if it's something where, oh, I really need this right now or something, then that's just pure addiction.
it could be that, but other people in that sense, yes, it could be addiction that way. But maybe some people just, it's like a stress relief. It's not if you tell them, hey, today you can't drink or you cut you off at the bar, then that person is not going to be like in an addictive state as in they're going to go seek it. They're just like, okay, well, I guess I couldn't have a drink today. No big deal. So there are levels of addiction and how much that is, but people that rely on alcohol in order to have a social setting, that's a form of addiction itself. But there are people that can go to a social setting, have a drink, or not have a drink and still have a good time. That's just a preference.
Okay. As in your line of work as a medical professional, would you say that your career is partially one of the reasons why you kind of stray away from drinking so often or at all if you don't?
Most of the time when you get into professional careers, you have to, it's just held at a standard, like a police officer, a teacher, lawyer, anyone that has a career. Or if you are dedicated to your craft, it doesn't necessarily have to be looked at by society, but if you're dedicated to your own craft, then you are trying to do something where you're not hindered in what you do. So being a physician, consuming alcohol is negative. Like you can make bad decisions. You are trying to lead an example to your patients and show them, hey, you don't need this, you don't need, or don't do this, you won't have any risk for cancers and all this. But I can't tell patients, don't do something if I don't do it. So that's one way to look at it. Unfortunately, some people with these careers are very stressed as well. If you look up the most common careers that have alcoholism, you would probably see in the top is mostly lawyers, dentists, also engineers, physicians. You look, and also very hardworking careers as well, like construction, all the ones that you have to be sharp and you have to use your body physically. So they rely on alcohol too as a stress relief. Overall, I would say if you have any job or career or anything, if you want to be the best at it and you're dedicated, then you should stay away from any substances that would contradict that.
That's a pretty good solid point you make there. Because I always thought that if you're, let's say you're a doctor, or I'm a doctor, you are a doctor, but let's say I am a doctor, would I not be contradicting myself if, let's say, for example, someone had a smoking problem, I told them, well, you shouldn't be smoking, but then I go back to the back and I start hitting a cigarette. And I've never really thought about how different levels of stress kind of play as a role. So with that being said, do you think there's any sort of benefits to what alcohol can bring? Not just any negatives, but any sense that it could have?
There's no physical benefit of alcohol. Like a lot of nowadays, when we have information readily available on their phone, anything, people are naturally more healthy. They lean towards no plastics, all natural, whole foods, all this, right? So if you're doing all this and then you're going and drinking alcohol, then you're defeating the purpose of all the good that you're putting in your body.
Absolutely, yeah.
And then you might eat clean all 3 meals and then you drink heavily at night, then you're kind of going backwards. But there are a lot of social, even cultural things that have alcohol built into their culture. just out of that, Italians drink wine with their meal.
True, yes.
And it brings families together. But is it, oh, are you just going to say, no, I'm not going to drink wine, Grandma? No, you would be upset. So I would say there's no benefit of it, but there are benefits as in it brings families together. There's some cultural things, but if you can do it in a moderate setting and it doesn't affect you and you that it's bad for you and you can stop whenever, then I think it's okay.
Okay. So in a social sense, as in like that's a very good point. Now that said, for any of your patients, and you don't need to get specific, but any patient who you've seen had trouble with alcoholism, what solutions or baby steps did you encourage for them to take in order to get off of it, or at least reduce it to the most amount that they could?
The basic step is to having the person realize that it is a problem. Because you can give them all the medications, all the support in the world, but if they don't see it as a problem, or if they say, no, this isn't, then you can't help them. So the basic thing I would just tell someone, if you have someone that is dealing with alcoholism or someone that is struggling, talk to them, tell them, hey, this is affecting your life. And if they can see that, that's the first step, because change only happens with the person. Unless they make up their mind and they believe that, yes, this is a problem, this is affecting me in so way, then that's the first step. And that's when you're willing to change. But other than that, if you can tell them until you're blue in the face that this is a problem, but if they don't think so, then you're not going to solve it.
So would that'd probably be the reason why they encourage AA meetings then and focus groups to remove or at least reduce alcoholism to its core.
Having a common community, having people in your corner, having other people in the same instances as you is very helpful for people dealing with problems. Even AA meetings, even there's similar meetings for cancer patients, for people with different problems. But it's shown that if you can relate to someone, or they can help guide you, or you look up to someone, or you can find so many resources in meetings, especially AA. So that helps, is having a community around you that will help show this.
Rather than taking the easy escape out of your own personal issues.
Having a problem and dealing with it alone is very difficult. It's always helpful if you have people around you, loved ones, strangers, anyone, just having people that you can either talk to or relate to, or have some advice, or even give advice. You would be surprised. A lot of alcoholics, we look at them and you say, oh, this is bad, but you can learn something from them. There's probably some reason why they became like this, and you never just look at someone and say, oh, well, they're an alcoholic, there's nothing I can learn from them.
Absolutely.
So that community really helps each other.
Any final words or any recommendations you'd like to give to the people watching the video, hopefully?
You're in college, right? So in college, is your time to, alcohol is very prevalent around this age. And, and because of you turn legal when you're in college.
I've heard a lot of frat stories. I have heard quite a few of those parties. I've never been, but...
So being a parent, I know saying no is not the right answer, because you're just going to do it anyway. But just know, hey, if you're going to do something, know what could happen, know the benefits, the drawbacks of it, and drink responsibly. Always never drink and drive. Always and about it, and talk to your friends. And if you guys have a problem with drinking right now, just know that you're not alone. And if you ever need to talk to anyone, you have many resources, and don't ever be ashamed of any problem. No one should ever be ashamed of anything. Yep.
Always take the right step. Thank you so much, Dr. Ali.
Yeah.
Thank you.